I'm David Race. When I retired, I decided to do something fun, and I started the marina, and I've been having fun 7 days a week ever since. I knew that my aortic valve was in bad shape. I met with Dr. Steinberg and all the other doctors that was going to be involved in this, and they said that I qualified. And so I got with my doctor and I said, "Man, you gotta help me get this thing done, because the idea of not having to have 6 weeks of grief when I can have it done in a week or two or three is such a different program."
So the thing that immediately struck us about Mr. Race was how vibrant he was. He was still an active member of the community. He loved to walk the dock and work in that marina, and just truly had a zest for living. And his ability to do so on a daily basis was starting to decline. He couldn't do the things he wanted to do on a regular basis. He couldn't behave the way he wanted to behave, and that was impacting the quality of his life. His primary cardiologist had recognized that this was likely due to aortic stenosis, and in view of his advanced age and a few other medical conditions, felt that he was at elevated risk for traditional surgery, and that's what led him to be referred here for evaluation. And when we saw him, it was evident. He wanted to feel better. He had clearly had a disease that was going to limit his life expectancy and his quality of life. He wanted to feel better. He had a good quality of life, and something that we really could aim for. And in him, the TAVR procedure is something that was particularly attractive. The TAVR procedure stands for transcatheter aortic valve replacement, and it's a procedure by which we can replace the valve, essentially implanting a new valve within the old valve, but doing it with catheters under X-ray guidance as well as under echo guidance, in order to minimize the insult to the patient's body that is traditionally accompanied with surgery. So we're able to, either through the groin or through the side or through any of a number of alternative routes, we're able to deliver the devices with catheters. In aortic stenosis, the aortic valve has become thickened and calcified, and it can't open as well as it normally would. In that case, the heart has to work harder in order to pump blood through the valve. And after a period of time, the heart's ability to do so becomes compromised, and that can lead to symptoms of chest discomfort, fainting, or shortness of breath. When that happens, we know the patient's life expectancies are significantly impacted, and patients don't live as long when they have symptoms related to severe aortic stenosis when compared to normal patients. The TAVR procedure can alleviate that. It can make patients feel better, it can relieve that chest pain, it can prevent the risk of them fainting, and it can relieve the shortness of breath, and it can also make them live longer.
Before, I think my aortic valve was leaking quite a bit, and there was a very strong murmur and this sort of thing. The doctor was monitoring very closely. and what they've done is they've done a perfect job on matching it and everything else.
Mr. Race is a genuine example of why we love to perform procedures like this. To hear that he's back at the marina, to hear that he recently had a low country boil, which is an annual thing for him and was one of the things that he was most excited about getting back to hear that that went as planned and went well, and to hear people who saw him there, including his referring physician, tell me that he just looked so vibrant and was so excited to be a part of everything again. That truly exemplifies why we do this procedure. That truly exemplifies why we strove to bring it first to MUSC and then to perform it and perfect it so that we could achieve the outcomes we achieved, so that people just like Mr. Race can enjoy the same quality of life that they were used to enjoying.
All I know is that I could not have been in better hands than Dr. Steinberg and his team. And as far as, the way they treated me the whole time I was there, the nurses, they were just, you couldn't ask for nicer people to take care of you.